Welcome to the Swift Healthcare video podcast, exploring the intersection of healthcare and leadership, hosted by Dr. Patrick Swift. SwiftHealthcare.com is your resource for healthcare professionals to find coaching and consulting to engage, restore, and transform yourself and your organization. And now, here's your host, Dr. Patrick Swift.
Welcome, folks, to the Swift Healthcare video podcast. Thank you for joining. I am delighted with our guest that I have for you. I believe this is a very special treat and a dear colleague and friend of mine I've known for 10 plus years. And I want to welcome to the show, Geoffrey Hall. Geoffrey, welcome to the show.
Thank you very much.
Hey, I'm glad you're here. And folks, let me read you a bio for Geoffrey, and I think you're going to enjoy this. Geoffrey Hall has more than 20 years of experience in healthcare administration. Geoffrey obtained an MBA in Management and Operations from Walden University, a Master of Social Work from East Carolina University, and a Bachelor of Social Work from Auburn University. Do you hear the thread of heart in the work that he does? He joined the Cleveland Clinic Rehabilitation Hospital system in October 2016 and currently serves as the Chief Executive Officer for the Cleveland Clinic Rehabilitation Hospital, Edwin Shaw, located in Akron, Ohio. Go Ohio. Prior to this position, Geoffrey served as the administrator for the nationally ranked Rusk Rehabilitation as part of the NYU Langone Health system from 2009 to 2016. And as a dear personal friend of mine, I have traveled the world with Geoffrey, having gone to China. We've gone to Qingdao and Guangzhou and Beijing and touched many lives and moved education, health education, medical education forward. And Geoffrey, with all my heart, welcome to Swift Video Podcast.
Thank you, Patrick. That was quite the introduction.
Well, there's a lot of love there, right? Right.
Absolutely.
So our episode for today, we are looking at leading through COVID and beyond. If I had a sound effect, I would tie it in right there. Leading through COVID and beyond. Let's talk about this from your experience, the gravitas of your experience, the perspective of your experience. You're a healthcare administrator with a global perspective, with global experience, while at the same time having been at the tip of the spear.
I would start by saying that certainly 2020 was probably one of the most interesting and maybe personally the most challenging years as a healthcare executive that I can remember. And I think you have to look back to how this pandemic started in the end of February, early parts of March, and just the uncertainty and the prevailing sense of dread and even fear. I remember just the one-on-one conversations with my frontline caregivers, nurses, therapists, doctors, as well as our leadership team. And there's just so much uncertainty and so much unknown as COVID really started to kind of spread across the world. And I know here in our Cleveland, Ohio area, in the partnership with Cleveland Clinic, the entire region was just preparing for this massive surge of patients that looked like it was going to, at that time, overwhelm the local hospital system. There was not going to be enough beds. There was not going to be enough caregivers. The Cleveland Clinic itself was decommissioned their state-of-the-art health education building, which is their newest building on their main campus, and started to build a 1,000-bed field hospital. The convention center here in Akron was being turned into a field hospital. And my location, being primarily a rehab location, was told that we were going to become a surge site. And, that was a change in scope and change of focus and change of service line for us. And that decision was communicated to me just after 5 o'clock on one day. And I was told I needed to put together an emergency plan over a 24-hour period. So, leaving work after what is normally a long day, went home and worked on this plan till at least midnight. And by midnight, I had pulled together almost a 50-page plan of how I was going to change my building into a COVID hospital. And communicating with my medical director, communicating with my leadership team, and then the next day, 24 hours passes, and I was told to kind of stand down. We're not going to do that. We're not. This is just a model. Let's think this through. And then about 3 days later, I got another call back from regional leadership and said, not only do we need to stand this up, but how fast can you stand this up? And from that moment, I think the clock started, and I had about 7 days to alter my building through construction, creating new patient and staff entrances and entire new workflow processes. And how was I going to create a closed and segregated COVID unit that would not mix with my other caregivers and my other rehab patients. And then that plan had to be scalable depending on the size of this surge. It was a really dynamic time because we were still, as a community, learning about COVID and what were the risk factors. And this is before, some of the lockdowns occurred, some of the mask requirements occurred, long before there was a vaccine on the horizon. So there was a lot of uncertainty. And I was very proud of my team because we did stand up a COVID unit in that short period of time. We built walls, we changed workflow processes, and we went from a place of
Walls,
uncertainty.
you mean partitions for safety, right?
Yeah, we built physical walls for safety as a way to, really create distinct care areas. And of course, PPE and, moving everybody into N95 masks and all of the requirements that we've all heard about. So we did that in just over 7 days. And then we started to admit COVID positive patients. And we were one of the first rehab hospitals within our company, certainly our region, that started to admit COVID patients and COVID recovery patients. And that really changed our model, and it kind of brought back this crystal focus on total care of the patient. And one of the unique things that we did, and I actually took away as a best practice, if you will, is we aligned our nursing and therapy schedules to identical 12-hour shifts. And we made patient assignments as a team. And what was really unique in that is you had nurses helping patients do their physical therapy exercises and get stronger. And you had speech therapists helping with bedside commodes and, the toileting needs of patients. And it was less about your discipline and more focus on what does this patient need to get better and get stronger. And as a result, the outcomes of this unit was so impressive. We had 0 acute or emergent send-outs. We had 0 patient falls. We had 100% of our patients discharge home. The gold standard for most rehab hospitals is about 3 hours of therapy per day, which is pretty intensive. And in the early weeks of this unit, some of our patients, because they turned that corner with COVID and suddenly started to rapidly improve after these long hospitalizations, they were getting 4 or 5 hours of therapy a day because the team, again, around this total care was just really focused on creating great patient outcomes. And, there were so many unique, heartfelt moments around this because my staff went from a place of fear and we don't know anything about this. We're scared, how are we going to be protected and how are we going to be safe? And that unit was formed with 100% volunteers, nurses, therapists, housekeepers, case managers. Everybody that went on that unit volunteered for that duty. And
Geoffrey,
we're really at the tip of this. Yeah.
I'm sorry, if I may ask, how did you do that? I mean, there's so much you shared right there. The preparation that then led to patients and that led to saving lives by building what you built. And then you use the word volunteers, that you gave folks the opportunity to serve on these units.
Right.
So how did you do that? How did you saying, folks, who's willing to volunteer?
Right.
What was that like for you? There's so much media coverage and putting on pedestals healthcare providers as heroes, and there's actually been some backlash on that, saying we're not wearing capes, we're real people and we're suffering and struggling too, and we're self-sacrificing. So it's not just a BS invitation. There is the depth of that offer to serve and self-sacrifice. So how did you as a CEO lead the team and lead folks to contemplate to serve on a unit like that?
So I'll give you a little bit of a funny story to that, and then I'll give you a more serious answer. So as I'm doing this emergency preparation over this 7-day period, our local newspaper in the Akron area ran a story of listing all the hospitals that were preparing for the surge. And this was not yet public information. So I'm walking into the building, I think 6:30 in the morning, and one of my night shift nurse aides who's ending her 12-hour overnight shift is walking out into the parking lot and stops me and says, "Oh, I saw in the paper that our hospital is becoming a COVID hospital. And that is not how I wanted that information to roll out.
That's not how you want your info to roll out.
No.
Yeah,
and
although it's great, you've got to engage an employee. Number one, the employees read the headlines, and she sees the CEO, and instead of not talking, she walks up to you and shares with you. So kudos on that. So, we can't control everything, right?
It rolls out. So I walked into the building, shaking my head, and then called an emergency management team meeting. Assembled our medical director and medical staff. And then over the course of the next 2 hours, I walked them through this plan that I had put together in 24 hours.
Sure.
But more importantly than that, when you're dealing with something that is moving as fast as COVID and creating as much change as COVID, I'm going to give the simple answer of you have to go beyond an email. Like, you can't just send out a memo. You can't just send out an email. When you're talking about people with questions and fear, and then they start personalizing this to their family, and then the reasons why they would or would not volunteer for a unit assignment like this, you can't overstate the importance of that one-to-one conversation. And what we did was really powerful is my medical staff combined with my non-clinical areas, so housekeeping, dietary, office staff, they didn't have their clinical knowledge to draw on. So we did in-services, and every single day we do what we call walking rounds, where we're engaging our caregivers, we're asking them questions, but most importantly, we're taking that as a chance to listen. What are your concerns? And then after we listen, that's when we give support. And then after we give support, that's when we give education. So it's kind of the old saying of no one cares how much you know until they know how much you care. So I think these walking rounds were the formula for that. I think they reinforced to our caregivers who were being asked to do very difficult things that they had never done in healthcare before. First, we're going to listen to you so you can, push back on us. And then we're going to support you, and we're going to reinforce that we really care about your safety and our patient safety, and that we have the expertise to do this. And then we're going to educate you about the right way to wear PPE and the buddy system to make sure we're wearing it appropriately.
Buddy system to make sure you're wearing it appropriately. Tell us more about that.
Yeah. So, it is pure accountability that they're watching your back, you're watching their back, because when you're having to put on N95 mask, eye protection, gowns, gloves, and you're caring for a highly infectious patient, the PPE is proven through science that it's going to keep you safe. We've been using it in healthcare for over 100 years. It's why we wear gloves. It's why we wash our hands. But when you're having to do this for every single patient that you're caring for, having somebody to make sure that you've tied your gown and it's snug, and that you're removing your gloves the right way. So using the buddy system and empowering our staff to be responsible for safety and connecting it back to, that purpose. And I think we're lucky in healthcare that most people come into healthcare because they want to help others. But now you have to take it to a different level. Yeah. And COVID, it really just reinforced, because it was changing so fast in those early months. We would set out a protocol in the morning, and by 4 o'clock in the afternoon, it had changed. And the confluence of so many different voices, both at a national and federal level, and then a local and regional level, things were changing so fast. I've never seen anything in my 20 years of healthcare where, information had to be validated, implemented, and rapid cycle kickstart into action so quickly. And every single day it was doing this. So we ended up starting where we have normal morning meetings. We were having huddles at first start of the day, midday, end of day. And we were doing these check-in calls just so we could rapidly get the information out. But then you had to follow it up with those walking rounds and those one-to-one conversations. So you'll hear this a lot in my responses, but it's focusing not only on the task, but it's really focusing on the people behind the task. Yeah. I think as leaders, we sometimes need to be reminded that we manage things, we lead people.
I was going to ask you, how did you change your leadership style in multiple directions, both from regional pressure or direction you received from your senior leadership, as well as how you supported others. And that dovetails right into that topic of how you shifted your style. And I love your point. It's worth you saying that again. I love that quote.
Yeah. No,
Please.
so I think as leaders, we need to be reminded that we manage things, but we lead people. And, as we went through this, I watched my own leadership style change quite a bit, because I had to, one, consider my audience, how I was writing and communicating and my verbal communications, and then going back to check, did you receive what I intended to say versus what you perceived I said? And having the trust and the accountability and making myself really vulnerable.
Ooh, I want to talk about vulnerable. Please, let's include that. Highlighter, vulnerability as leaders, how you manage that.
I think being an effective leader in today's world, you have to be able to be in touch with your emotions. And I'm going to actually say that you should be comfortable using your emotions, not losing your emotions. So no one wants to have the leader or boss that loses their temper and just like flies off at the handle. And I say that and I mean that. But at the same time, our patient safety really matters. And if you got one person that's refusing to wear a mask or not washing their hands or not taking some of these precautions safely, it's okay to be disappointed and to really connect it back to not just this is a task that I'm expecting you to do, but here's the why behind it.
Right.
And I think it's okay to be passionate about being the best and having the highest quality. I think it's okay to want your patients to get better, not worse while they're in your care. I think it's okay to say, I'm scared and I'm tired and I'm exhausted, because when COVID started, I worked 3 months in a row without a day off. And to say, I'm really, exhausted and I want to step back, but for me to step back, I need you to step up. And I had some of those conversations with my leadership team, because we were convening these leadership huddles 7 days a week to make sure we were on top of this. And you have to also pay attention. So when they start to get tired and they start to, feel and express themes around being burned out and being exhausted or being scared, you need to give people permission to cycle down or say, I really need help. I'm exhausted. I'm going to take Saturday off. If you can help me cover this activity. It all goes back to communication and how we support each other. And that's one of the things that I was really proud of personally, but also I just saw countless examples of how do we care for each other, and using that emotion and passion and to create that connectivity, and just really having honest conversations, which means not just telling everybody you're doing a great job. And that's important to say, but it's having the courage to say, we need to improve in this area. And it's not personal. It's not you need to improve. We need to improve. And we're in this together. And here's what we really need to focus on right now if we're going to create these great outcomes and get our patients home. More importantly, how are we going to keep our staff safe, and how are they going to be able to keep their families safe? So I don't know that there's a start and end to that, but this past year, there's so much more reflection on vulnerability and being authentic with people and using that authenticity to give real support, not just kind of the easy conversations. And the challenge with that, and it's really impacted our leadership style, is COVID has kind of taken away all of those social norms of eating together and celebrating together.
Right.
And how do we come together? Like even now, our hospital meetings are all virtual Zoom based. So even the ability to be in the same room and have conversations. So we've had to kind of shift to a more virtual world and more socially distanced world.
I want to ask you on that, how you're driving cultural engagement and those quality conversations in light of what you just said, that there is such disconnection at the same time, such a need for us to be connected.
I don't know that I have the complete formula figured out, but I think just as you would do in a regular meeting where you all come into a larger space or a conference room, when you're on a Zoom call with 10 plus people, you still have to make time for that pre-meeting, post-meeting small talk. like really checking in with people. And that's something that I've started to do as I run meetings via Zoom quite regularly now, is at the beginning and end of the meeting, I'm going to ask a more thought-provoking, more personalized question. And I'm going to give people some time to kind of respond. And then we interact with each other off of that, because you can get so focused on this is what we're talking about in this meeting, that those small interactions that validate us as human beings and connectivity and purpose, we miss that. Those water cooler conversations, those coffee pot conversations, everybody kind of sidebar chatting before the meeting starts.
I want to jump in on that one because you remind me of one of our heroes and someone you and I both revere, which is Steve Flanagan, Dr. Steve Flanagan.
Absolutely.
And in a meeting, this was years ago. I mean, I had hair and we were at NYU. We were in a big room with a lot of folks, and Dr. Flanagan was speaking to the audience, the group, and he at the end of the staff meeting, he asked what questions do people have, and he explicitly said, I'm going to count to myself to give you time to think about what you want to ask. And he was jokingly, but like 1, 2, but
he used to count to 8.
Yeah, there we go. He'd count to 8. Like he'd let people know, not from like, we get to 8 and I'm out of here, but I really want to give you time to answer. And you just touched on Zoom calls where you're asking a thoughtful question, and that's demonstrating the heart of leadership. That is the lion heart of leadership, where you're not afraid of what someone's going to say. There's courage, there's courage there, there's heart. So I appreciate your bringing up pausing, and thanks for reminding me about Dr. Flanagan and his example to us.
No, I learned so much from Dr. Flanagan, and I remember those pauses at the end of meetings, because whether people had something on their mind that they were ready to talk about, or they just needed that space, and people want to fill that space. So you've got to
want to be part of that space, right?
You got to build in some time with your virtual meetings to let people be people. And I reminded of that every single day. The other thing I love about Dr. Flanagan, since you brought him up, and I think it's a good reflection as a leader, is finding ways to say yes. And he just embodied that so much. And I try to bring that into my own style, because it's easy for us to just say no of why something can't happen. But you start to open up all these possibilities when you start to think, or give yourself permission to think, or others to think, what if we said yes? And I think that really created a lot of success even with this COVID unit, not finding why we can't because we're a rehab hospital and we don't do COVID.
That's just instead, not the way we do things around here, right? The perspective,
finding
how
ways
can I
to
say
yes? And then if we're going to say yes, how do we do it well?
Right.
Or better.
Yes, at the right time, at the right reason, with the right goal, and discerning that. Beautiful.
Yeah,
Beautiful.
It's completely empowering.
Hey, let's talk about one concept you and I have touched on is responsibility 2 and responsibility 4. You threw that out there on another conversation we're having, and I want to ask you to unpack more of that, because I like the direction that's hinting it's going.
Yeah.
Curious your thoughts.
I use the difference between responsibility 2 and responsibility 4 as I'm training new leadership and new managers, because we sometimes mistakenly think that we're responsible for the actions and behaviors of other people, when intellectually we all individually know that that person is responsible. But when we have managers and leadership, we feel a certain amount of ownership, and you own your quality, you own your team, you own the identity and reputation of your organization, and you feel like that's a reflection. And I think we have to make that distinction. And if you're responsible to someone, you're giving them feedback, you're being honest, you're giving them opportunities and time to correct and to learn from. You're giving the training, you're giving the education, and then it's up to that person to do something with that. And whereas if I'm responsible for something, then you sometimes go down the slippery slope of thinking that you're the only person that can do that, or you're the only person that can make a decision, or you're the only person that can create a successful outcome. And when you start to pull it back and feel like I have to do it myself, my honest opinion is I think we're starting to fail as leaders. And that doesn't mean leaders aren't high performing, overachieving, get things done kind of people. But if you're going to trust and empower and build and be a people builder, then you have to be able to identify and have that hard talk with yourself sometimes of, am I being responsible to this person and giving them all the feedback and education, training, support to be successful, or am I feeling responsible for this person? And there were times in this past year thinking about the urgency of COVID in our hospital operations, I felt a lot of responsibility for. And to not disempower or lose or disengage or burn out my team, I had to be able to pull myself back and say, I'm going to be responsible to this person, and I'm going to trust and empower this person to be an extension of my vision and what I want to accomplish. And we accomplished a lot more together than I could have done by myself. So I just think it's a really great topic. And I don't know that you ever completely resolve that balance, because it's a seesaw where you do have to have some ownership and you do have to have some passion and you have to have high levels of engagement and follow through. But at the same time, if you're doing this with people in leadership, it's separating the responsible to versus the responsible for.
I like to call that the yoga of healthcare, where we're as leaders, we're staying flexible at the same time,
right,
to support the good work that's being done. It's a beautiful way to put that together, Geoffrey. Also want to talk with you about the patient experience and challenges and lessons learned during the past COVID adventure and your future vision of how you're advancing the patient experience.
You know, that's a great question. I think it's evolving. So in our hospital setting, we do a significant amount of family training where we involve adult children, spouses, family members in the care of the patient, because our goal is to get those patients home. And you're moving from a setting where you have 24-hour nursing care and great therapy care to your home environment, which really doesn't have as much of the same supports and infrastructure. As part of COVID, as we had to lock down and change our visitation processes, we really had to implement some new ways to continuously get our patients home, despite not having people on site and on premises. So we implemented a lot of virtual FaceTime training where therapists and nurses working with the patient would have the family member on a video screen and interacting in the session. We converted all of our support groups for brain injured patients and spinal cord injured patients and stroke patients to virtual. And what the unintended benefit of that is that we sometimes think that we start a group and it's just accessible to everyone, but not everyone has transportation or the availability to come to a group setting or a hospital setting. So our participation and enrollment in some of these groups nearly tripled because the virtual aspect gave more access to care and access to follow-up. And what was really powerful, particularly with our COVID support group, was the peer support. It wasn't the healthcare professional leading the discussion. It was everyone else talking about the long haul symptoms that they had, how that had impacted their family.
Outstanding.
And more importantly, I think there was such a stigma around the patients who were early diagnosed with COVID, and it started to kind of normalize that. So we really went to a virtual strategy, and certainly across healthcare, you're seeing an explosion of telehealth, which has been around for years, but it's now becoming mainstream because it's creating a better access of care. If you think personally, why would you want to go to a crowded doctor's waiting room or an emergency room right now if you could access the same doctor and actually have a really personal conversation with that doctor about what's going on with you via your phone versus doing that? And I'm not saying healthcare should be all virtual, because from a patient experience, one of the things we had to do when we limited our visitors and had no visitors during the holidays is we just tasked staff every day to say, you need to go do some social rounding. Like, I want you, like, there's no task, there's no activity, there's no procedure. I just need you to go in and have a conversation with how this person is doing. And keeping that human connection. You know, we brought in musicians, and it was one of the best things I saw in 2020, where I had a opera singer and a violinist in a hallway. And because we had to be socially distanced, our patients came to their doorways of their patient rooms and sat in the doorways so that they were more than 6 feet apart. And in the center of the hall, I've got somebody playing a violin and an opera singer. And lots of hospitals do those kinds of things on a regular basis, but doing it in a COVID safe way.
During COVID, that's unusual, and it speaks to patient and family-centered care. And
Yeah.
I love what you said earlier about it not just being a top-down, the clinician doing training to the family, but you said that the family are speaking up and part of the conversation during the peer-to-peer support. That's patient family-centered care, where they have the voice. It's the collective. It's us together, as opposed to a sense of separateness.
And I would say in healthcare settings, we often focus on our patients, and you'll hear patient-centered care, and that's been a buzzword for the industry for years. But I want to expand that, because we had to go through this, and this was a hard-learned lesson for us, is when we first went through our COVID rollout and changed our operations, we were really well focused on the staff experience and the staff education and the staff safety. And I actually had a patient in our hospital who was recovering from a spinal cord injury and was hospitalized before the COVID lockdown, and then was with our hospital as we made all of these drastic changes with COVID precautions. And he came to me and he said, "Your staff are great. You know, they really know what they're doing. I really see that they feel like you've got this COVID thing under control, but my family is concerned. And so what can you do around that?" So I sat with him for a couple of hours, and he rattled off a number of questions. And then as a leadership team, we went back and we had to revisit every single one of those questions with the lens of, how do we communicate this to not only this one patient, but patients going forward? So as a result of that, we came up with a new family communication plan. And who is making the calls, and how often are we making the calls, and what's the content of this call, and how are we passing this off, and how are we just acknowledging that families are anxious because they can't see their loved ones right now, and all of this other stuff is happening in the world. So let's kind of raise the bar on customer service. And you know, some of that was FaceTime calls, and our rec therapist did an amazing job of using FaceTime to do virtual visits. We did a virtual 70th wedding anniversary for one of our patients and their families, because the spouse was hospitalized. You know, we had to rethink of, how do we help families celebrate birthdays and anniversaries? And I really want to stress that family communication, because it's real easy to go rounding and go talk to a patient and explain to the patient. But you've got to do that 2 or 3 times if they've got a son and daughter that live out of state, a family member that lives in the local area. Like, sometimes you would learn that you're having all these update conversations with a family member, but they're not the decision maker family member. So really trying to, and not be defensive about that, and say, okay, you're not here, so we can't share this information in person. So what extra level can we go to make sure that your experience matches the same care that we're providing to the patient?
Outstanding. Outstanding. One of the questions I love to ask, and I want to ask you, if you were standing at the top of the world and you had the attention of all the healthcare folks, physicians, nurses, therapists, staff, leadership, all the folks who work in healthcare, for a brief moment, what would you say to healthcare across the planet right now?
Well, I'll answer that with what I wish somebody had told me, and I've had to figure out and continuously remind myself of. And it's to focus on the people providing the care. And it's my belief that if our caregivers feel supported, and we're really developing them from a skill enhancement, but just focusing on empathy and their overall experience, then it's not unreasonable to expect great patient experience and great outcomes. But we have to focus on the caregivers. I think oftentimes we bury people with tasks and audits and activities, and we need to remember that there's a person that's behind that. And I think I want us to become more accountable for development and resilience versus a burnout culture, because that was one of the key things that I was reminded of this year. Was we had our third wave of COVID surge across our community, and I started to see at one point our local area was at a 33% positivity rate, and there was no backups. There was no additional nurses or nurse aides or therapists on the bench that could come in and take care of our patients. So it was mission critical that we tried to keep our own staff safe and just managing that, because even one person calling out was the difference between a good shift and a bad shift, a good day and a bad day. So for me, I wish somebody had even earlier had reminded me, just focus on the caregivers. And if you do that, the caregivers will remember and take great care of the patients.
Hear, hear. And that is global thought leadership in healthcare right there to a T. I want to ask you, if folks are interested in following up with you or had a question, how could they get in touch with you?
Sure, absolutely. And thanks for the time, Patrick. I always enjoy our conversations. The best way to reach me would be my email address. And would you like personal or work?
Well, I'm not going to put that on the show, but how about your LinkedIn profile? If folks are interested in connecting with you on LinkedIn.
Yeah, I'm not on other social media channels, but you can certainly find me on LinkedIn. But I am the kind of CEO that gives my personal cell phone number out to my patients, their families, my staff, because I don't know if you can care about people and just have a start and stop time.
Beautifully said. Beautiful leadership, beautiful perspective. Geoffrey, thank you so much for being on the show. Thank you for being on the Swift Video Podcast, Swift Healthcare Video Podcast. And folks, I hope that you take away nuggets from what Geoffrey had to share. And Geoffrey, thank you so much for being on the show.
Thank you, Patrick.
Thank you for listening. Please subscribe, rate, or leave a review about the show on your favorite platform, and learn how to support the podcast as a patron at swifthealthcare.com, where you can also find the show notes and all of our episodes. Thanks for joining us.